Ready? Okay. We have a 50-year-old female. She's noticed with as she is getting older, she has noticed more sagging of her face. Let's go into this picture. She was really bothered. She works out nearly every day.
Yes.
You work out every day,
Yes.
right? So, and she's lost a little volume, and as she's losing also the volume, she's also felt there was a greater laxity. So, she's seen much deeper nasolabial line, almost connecting to that marionette line and jowling. So, the plan today was to do a little thread lifting to improve upon the jowling and the marionette line, and also to give return a little bit, restore that little bit of that volume back by putting a little fat to the mid cheek area. The third part that she's going to do today is she underwent the removal of the fat bag roughly 10 years ago, and she's noticed a little return of the fat. Let's show this eye and this eye right here. And she's going to do a little bit of revision removal of the lower eyelid fat bag. So the first part that we did today is we did the thread lifting on the right side, and let's show this picture because everybody has one side that's a little more narrow and a little more high up, and the other side that's a little more down. Cheek wise, there's always a difference, and right now this was inherently the lower side, but having done just the thread lift on one side, you can clearly see that the thread has lifted the lower cheek higher than what was always the higher cheek, which is the left side. So that clearly shows the effect of the thread. And more important, from the lateral view, you can see that the nasolabial line is connecting to the marionette line and definitely shows jowling. And let's go ahead and have a flex a little bit. Upon flexion, you can see multiple lines sagging down to the below the chin. But let's go ahead and really show how defined her jawline has become. And the marionette line has almost disappeared. And also, there's a significant improvement of underneath the jaw, underneath the chin as well too. So I think she's gained roughly about 70 to 80% of what a traditional facelift would have provided. Really, with no sign whatsoever. There's no bruising. There's no swelling at this point. She will probably swell up a little bit over the course of the next few days, but she can pretty much have this thing done and literally go back to work tomorrow if she wanted to. Okay, so this is part one, and hopefully after we're done with the part two on the other side, we can show how she will look after both sides is completed. Okay, so Toka, how you feeling?
I'm feeling okay.
Yeah.
I'm not in the pain.
Mm-hmm.
Procedure is going smoothly. Yeah, he's doing great.
Okay, thank you. All right.